Hello, thank you for participating in our survey. This video is about hepatitis B virus, or HBV, and hepatitis C virus, or HCV. We hope that this video will encourage you to get tested for hepatitis. We are a group of students at the UT Health San Antonio Long School of Medicine passionate about the Asian American community and hepatitis education. What is hepatitis? Hepatitis is inflammation of the liver. The liver does a lot to help us survive, like processing food and detoxifying our blood. Three viruses that cause hepatitis are A, B, and C. Today we will be focusing on hepatitis B and C. Hepatitis B is more common in Asian countries, and Asian Americans are at a higher risk for HBV. About 3.5 million people in the US have HCV, which is about 1% of the US population. It is a leading cause of chronic liver disease and puts people at risk for liver cancer. While both hepatitis B and hepatitis C cause long-term infection, there is a vaccine for hepatitis B, but there is no cure. Hepatitis C, on the other hand, has no vaccine, but there is a cure that completely gets rid of the virus. Did you know 1 in 12 Asian Americans is infected with hepatitis B and most don't know it? Most people born in Asia who have hepatitis B were infected as infants or young children. Hepatitis B is the #1 cause of liver cancer among Asian Americans. Infections with both hepatitis B and C viruses are silent, meaning symptoms rarely appear immediately after infection. Because of this, the infection usually stays undiagnosed for a long time, so many don't realize they have it until there is advanced liver disease. In fact, 2 out of 3 Asian Americans with hepatitis B don't know they are infected. When symptoms appear, many parts of the body are affected. Common symptoms are fatigue, yellow skin or eyes, nausea or vomiting, lack of appetite, bleeding or bruising, and dark urine. 75 to 85% of people with untreated HCV will develop long-term infection. This can lead to liver damage such as cirrhosis or hardening of the liver cancer, and liver failure after 20, 30, even 40 years. HBV and HCV are most commonly spread when someone comes into contact with the blood of someone who's infected. This can happen if you use needles that have been used before, or if you received blood before 1992, when blood was not screened for HCV. Both HBV and HCV can also be spread through cuts, such as during childbirth or sharing razors or toothbrushes. While HBV can be sexually transmitted, HCV is rarely spread through sex. Hepatitis cannot be spread by the air or by sharing meals, bowls, or utensils with someone who has the disease. Studies have shown that Asian Americans with HCV were less likely to have these risk factors and thus are less likely to be screened. Possibly due to these reasons, Asian Americans are often diagnosed later in the disease and thus have more liver damage. So who should be tested for hepatitis B? Hepatitis B testing is recommended for people born in Asia, people whose parents were born in Asia, and people who live with someone with hepatitis B. Who should be screened for hepatitis C? All adults age 18 to 79 should be screened at least once even if there are no risk factors or symptoms. Pregnant women should be screened during every pregnancy. During an HBV and HCV screening, a blood draw is performed. If you are positive for hepatitis B, treatments are available that can slow down liver damage. If you're positive for hepatitis C, there are medications that can completely cure HCV so the virus is no longer in the body. Most of the medicines can be taken by mouth for 8 to 12 weeks with very few side effects. More than 90% of patients are cured after taking this medication. During the COVID-19 pandemic, we realize it's important to take good care of our health, even if we feel healthy. This is the same with hepatitis because most of the time you won't feel sick until you have serious liver disease and even liver cancer. While there is no cure for HBV, the hepatitis B vaccine is a safe and effective way of protecting someone who has never had hepatitis B from getting it. In terms of COVID-19, studies have shown that those with liver disease and liver cancer may be at a higher risk for severe illness from COVID-19. To summarize, hepatitis B and C are silent infections that rarely show signs or symptoms immediately after infection. If untreated, long-term infection can result in liver damage and liver cancer many years later. All adults 18 to 79 are recommended to get screened for HCV. Asian Americans, particularly those with parents born in Asia, should get screened for HBV. This can be done by a blood draw. If a person tests positive, there are medicines that can slow the liver damage in HBV or cure HCV. Thank you so much for viewing our presentation. Please move to the next page to take our post-survey to help let us know how we did.